In the absence of a vaccine, plasma from recovered COVID-19 patients has emerged as a possible treatment for the disease around the world and here in Ghana. The Convalescent Plasma Therapy, which was locally introduced in April, is administered to critically ill COVID-19 patients. Dr. Mahindra Karpan, head of internal medicine and cardiology at the Georgetown Public Hospital, said that the therapy, which is administered with patients' consent, is usually a last resort.
So we've had 4 patients. And what we've been able to demonstrate is that we can collect the plasma from donors safely, we can process it safely, we can give it to patients safely, and we have seen 3 out of 4 patients survive and do well.
Dr. Karpan informed that unfortunately the first patient who underwent the therapy at the Georgetown Public Hospital succumbed due to other medical complications. Nonetheless, he posited that this therapeutic approach is ideal in response to the dreaded disease.
It's safe, it's cheap, and with our challenges, we have to look at our resources and use what we have. We could dream and hope for more sophisticated therapeutic modalities. But as it is, we will have to use what we have within the limitations of our resources.
Some of the critical conditions that indicate that a patient might require the convalescent plasma therapy include severe pneumonia.
When patients start requiring oxygen therapy, normal room air cannot maintain their oxygen saturation in the blood. So that's the first stage really that we start to have alarm bells. And of course, the patient's respiratory rate.
Survivors of COVID-19 have been donating their blood plasma in droves at the National Blood Transfusion Service, which has been aiding in the fight against COVID-19. The plasma, which is rich in antibodies that can fight the virus, is extracted from the survivors and are stored by the Blood Transfusion Service. It is then transfused to the affected patients, while the red blood cells are returned to the donors. Temika Rodney reporting for the HGP Nightly News.